Sometimes you get a little greenish discharge from the nose in a child, and the parents immediately think it's a sinusitis. That doesn't always mean you do have a sinusitis. Is that true?
That's correct. Just because the mucus is green or yellow does not necessarily mean you have an infection. The whole picture has to be taken into play, and oftentimes you'll have fever, you'll have discharge that lasts for a considerable period of time. Simple things like allergies and irritants can cause mucus that has some color.
But if it's persisting for a week or 10 days and this headache and everything, sometimes we'll empirically treat it as though it is a sinusitis. Is that true?
That is true. And the other thing that can happen in some children is you can have an adenoid infection or adenoiditis, which can also cause a purulent nasal discharge.
If a kid keeps getting sinus infections, what would you as an ENT doctor try to do?
The first line is to start simple, and is to use nasal irrigation with salt water, saline nasal irrigation. Depending on the age of the child, there are some nasal sprays that can be used now. Certain nasal sprays are indicated down to age 2, and many of them are indicated down to age 5. Those are the first line therapies for recurrent sinus or recurrent adenoiditis.
That's to keep the river open, is that correct?
That's correct. To keep the nose open and to decrease the inflammation in the nose, and hopefully keep the sinuses as they're developing open and aerated. As you get more advanced, then we move down the line in options, and sometimes adenoidectomy is the next step.
But where are the adenoids located?
The adenoids are essentially tonsillar tissue, the same as tonsils, which is lymphoid tissue, which sit at the back of the nose. And so if you were to take and draw a line all the way back to straight to the back of the nose, that's where the adenoids live.
So if you got rid of that blockage, many times the sinusitis doesn't reoccur?
If you remove the adenoids, which can be chronically infected, and oftentimes that infection will resolve, and sometimes the adenoids have been implicated in seeding the nasal cavity and the sinuses for infection.
And sinus infections usually treat longer than the usual 10 days. Is that true?
It's correct. Sinus infections are treated longer than, say, tonsil infections or ear infections, where sometimes we treat for 7 to 10 days. And sinus infections, the treatment can be 10, 14 days, and sometimes even longer, depending on the...
Some guys even do it longer than that.
21 days to a month.
It's possible. But if you keep getting sinus infection, they go to you. What would you do? Would you look up the nose with any instruments?
Sure. There's a more in-depth examination that we can do in the ENT office, and that includes doing a nasal endoscopy. And a nasal endoscopy is essentially taking a small light, which is on a fiber optic cord, and looking into the nose to examine whether the sinuses are infected or if the adenoids are enlarged. It also gives us some diagnostic capacity in determining if nasal polyps are present or if there's any other process in the nose.
If there's some blockage, you might have to clean the blockage too, right?
In children, sometimes you see actually foreign bodies that are in the nose that can have colored discharge.
I once had a miniature rubber hose up the nose. And
That's right.
Kids are amazing.
Amazing what you can find.
When is the sinusitis an absolute emergency? There is time to don't sit on it.
That's correct.
What would be the signs of one that maybe it's encroaching the eye or something? What
Sure.
would be the indicator?
The indications there's several structures which are vital, which surround the sinuses. The eyes, which obviously the ethmoid sinuses are right in between the eyes, the brain, and those are the main structures you want to look out for. Having nasal secretions, fever, with a swollen eye or swollen eyelid. You can get a periorbital cellulitis or subperiosteal abscess, which is an infection that's spread now from the sinus cavity into the eye.
That's something you don't wait till the next day. You take care of it now.
Immediately. It's one of the absolute indications to perform surgery for sinusitis. You have to drain the infection. The other is a mental status change, when the infection could potentially spread from the sinuses to the brain or into the meninges. You can have a meningitis, a brain abscess. These are some of they're very rare, but these are some of the bad things that can happen with sinusitis.
That's why you're very careful.
Correct.